So if we talk about exercise in general, and in the literature, it's also known as physical activity. So it doesn't have to be anything too formal or scary. It doesn't necessarily require lycra. It can be anything as simple as getting out in the garden or even taking your dog for a walk. The exercise guidelines for cancer survivors are pretty much the same as any other population group. So whether that's general population or also patients, sort of cardiac patients or diabetic patients. So 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. And we advise that it's best to start in small doses, especially if you're someone that's not used to exercise, and then build up gradually. And you can actually break down that 150 minutes into more smaller manageable loads. So if you look at 30 minutes, 5 days a week is your 150 minutes, but you can break that down even into 3 blocks of 10 minutes. So I will say it's imperative that you regain your full shoulder movement before starting any resistance training. So before doing any strength, before adding any weights in, try and get as close to full shoulder movement as you can. The reason for this is because when you add load onto an arm that has poor muscle patterning, you can actually cause further musculoskeletal problems. And that's, as I mentioned before, you can start getting neck pain, start getting problems in the other shoulder. So I really recommend activities like yoga, Pilates. I know different places run stretch and relaxation classes. So we're trying to sort of lengthen out the muscles, get the shoulder moving nicely. And then down the track, things like dragon boat racing, stand-up paddleboarding, tennis, they're all going to be absolutely brilliant for strengthening up the shoulder and keeping it nice and mobile. So while we want you moving your arm, we want you to avoid repetitive overuse of that arm. So I know that sounds tricky. We want you moving it, but we don't want you moving it too much. But it's really sort of avoiding anything going too over the top. So I once had a patient who went on a kayaking trip for the weekend. So she was kayaking 8 hours a day over 3 days, and she came back and unfortunately developed lymphedema. So it was just that repetitive kayaking motion was just too much for her poor arm. The way that osteoporosis is linked to breast cancer treatment is the use of drugs such as tamoxifen and other aromatase inhibitors such as Arimidex. So patients can be on these drugs for 5 years after treatment's finished, and that's what affects the bone density. And then when it comes to exercise, our goal is obviously to stimulate bone strengthening. So the most effective form of exercise for this is anything weight bearing. So walking, jogging, even doing body weight leg strengthening like lunges, squats. That's resistance training as well, because you're using your body weight as a weight.